This is a common scene in a veterinary emergency room. There are two trainees relegated mainly to restraint, and two clinicians involved in clinical management of the case. While the trainees can learn a great deal by observing the clinicians, their opportunities to apply their clinical knowledge base, make decisions, and see the results of those decisions is all but absent. What would an ideal training environment look like? It would be one in which learners would be allowed to apply the concepts they've learned to clinical cases, collecting clinical data and synthesizing the results, and formulating their own diagnostic and treatment plans. They would practice this in a real-time, high-stakes environment in which they could see the results of the clinical decisions they've made. At the conclusion of the scenario, they could get critical evaluation and feedback from an instructor, and ideally learn from the mistakes they make during the course of the scenario. And all of this would occur in a safe environment for learners and for patients. The concept of immersive simulation is to provide a safe environment for such practice and exploration to occur that would allow events to unfold in real time without intervention from a teacher, that provides physiologic feedback linked to treatment decisions made by the learners, and that facilitates learning through post-scenario discussion and evaluation. Veterinary simulation products for immersive learning experiences have been limited to static mannequins that provide minimal physiologic feedback and that are focused mainly on practicing the mechanics of CPR, as well as to task trainers like intubation heads or catheterization models that allow skill development but not clinical decision making. The concept of high-fidelity canine simulation is to provide realistic physiologic feedback, such as spontaneous respiratory movements, that require learners to apply assessment and critical thinking skills in real time to a patient. In addition to physical feedback, a simulated patient monitor provides clinical data such as ECG waveforms, pulse oximetry data, and blood pressure synchronized to the physical feedback provided by the mannequin. Other physiologic feedback includes heart and lung sounds that can be evaluated by a stethoscope. Normal sounds, such as heart sounds, and lung sounds can be simulated, as can abnormal sounds such as heart murmurs, pulmonary crackles, and lower airway wheezes. All of these sounds are synchronized with patient chest excursions and the waveforms on the patient monitor. Bilateral palpable femoral pulses synchronized to the patient monitor are also present. Using this system, simulations are run in real time without instructor intervention to allow learners to practice, develop critical clinical and communication skills, and to make mistakes. The instructor watches remotely, controlling the simulator with a computer using pre-programmed scenarios that can be changed on the fly if needed. Groups of learners can also watch scenarios remotely with multiple views of the scenario, audio, and the patient monitor display. At the conclusion of the simulation, a facilitator leads a debriefing including participants and remote observers, in which peer teaching and group discussion allow learners to process what they've experienced, identify mistakes, and learn from them. In summary, high-fidelity simulation allows learners to practice in real time, facilitates learning through experience, enforces psychomotor and clinical assessment skills, supports communication and team building, permits and encourages mistakes as a learning tool, and is a fundamentally different way to teach and learn. For more information, contact Dr. Dan Fletcher at Cornell University.